Without further ado, let's go to Dr. Anita Ray-Chowadhury, Director of Luton CCG. Welcome to InspireFM.
Hello, thank you for having me.
Thank you ever so much for giving us your time this morning. Speaking about child health and well-being, a very, very important topic. Often it is a situation where sometimes when we are not feeling so well, we can be in a position where we just kind of tag along and think we'll be okay. But children's health, again, it's very, very important. Again, something that really does concern us. What are the most common problems that parents actually take their children to the GP or maybe to the hospital?
It's interesting. I know that we'll be discussing this later on this evening, but so I think one of the most common problems is actually the worry. So things simple, they're new parents, they don't understand what kind of, like colic, common rashes, sometimes difficulty with breathing, so they could be quite congested, have a cold and so forth. So these are kind of the more common causes that they might come with: diarrhea, vomiting, a little bit of tummy ache. But then it can be also an exacerbation of their common problems, which might be their asthma or their eczema, and wanting to know how to treat it. I think one of the challenges has been helping patients and guiding patients to know when to go to the hospital, when to go to your primary care, when to seek advice from elsewhere. And helping them understand that so they can get better.
Is there any help available maybe online or somewhere where you can actually, a very simple guide to say, well, if your child has this, go here. If this is the case, go here. Is there anything simple, or, because to be honest, majority of the time when you try seeking advice online, there is just, ample amount of information there, and it does actually take somebody, at a certain level to actually read it all through and actually digest it and think, well, what do I actually do now?
Yes, so there is things online. I'll be honest with you, as a clinician, especially when it's children's problems, I think it can be you're already quite anxious, and making the decision from line can be quite daunting, especially for a parent. So advice might be better from 111 because you've got a human being on the other line, and you can actually sort of explain certain things to them, which you might not be able to do so easily online. If you're very clear and you understand exactly what the problem is, there is things like NHS advice, which is online. But I would probably direct people to 111, which is a free line, and they can get somebody to talk to if they're not sure what to do.
And is that a service which, is used to these calls? Is that not an emergency service which only you use for emergencies, or can you call 111 just for advice?
Absolutely. So 111 is designed for several things. So it can be if it's an emergency, it can be if it's just an advice. They are 24/7. So they are simply to provide you access to the appropriate care. So if they talk to you and they realise, well, actually, no, this is an emergency, they will immediately direct you to it for it to be an urgent emergency. But if they think it's an advice, they will go through that with you as well. So they're there to help guide our patients to the right resources.
Excellent. And also, generally, is there anything particular on the rise at the moment? Sometimes, you have your colds and flus, and sometimes a variety of different viral infections going around. Is there anything particular on the rise at the moment, particularly concerning children?
I think due to the time of year, breathing issues, so congestion, so people getting coughs, colds, not really knowing what to do, especially if they've got asthma. So I would say breathing issues, and also as the weather's changing, people don't know the difference possibly between the allergy, which can also cause congestion, sneezing and so forth. So I would say that's a little bit on the rise more because it's seasonal.
Okay, seasonal illnesses will, of course, always be a problem there. What about from an expectations point of view? Often we have parents sometimes not necessarily complaining, but being felt disappointed in the fact that they go to see a doctor hoping that they will give them some kind of medication, and the doctor just gives them some kind of advice to say, well, this is what you need to do. And should there be an expectation from a parent to always walk away with medication after seeing a GP for their child?
So being a parent myself, I have a 1-year-old and a 6-year-old, I can understand that there is this hope that if you go to your doctor, that they're going to sort of give you something which is going to cure your child and make them feel better. After all, that's why you've gone there, and hoping that, it's going to get sorted. And I think the expectation is there. Sadly, I would say it's not correct, but I can understand why it's there. The problem is that actually a lot of the time, majority of the time, when they come to us, they don't need medication. So common things like a rash actually might need something to be removed rather than being given a medicine, if that makes sense. So actually advice is sometimes more powerful than actually giving a medicine. And what we're also seeing a rise in is that we're getting a lot of resistance to antibiotics. We have to tackle that in the appropriate way. So if we give it incorrectly, some children can get diarrhea inappropriately because they've been given a medicine that they don't need, and obviously their body's going to reject that. So I think we've got to be careful and also advise patients that actually by giving you something, I'm not necessarily doing the right thing and the best thing for your child. And that's something we just have to work with parents, not just as us as clinicians, but your health visitor, your children's centres, your school nurses. All of us need to work together to give the same message.
Definitely. I think education plays a big part in this itself. One other concern is obviously sometimes you'll have this situation, I'm sure, with your 6-year-old rather than the 1-year-old. You may have already experienced this. When children go to school, you will have this one child who has got this some kind of flu or some kind of viral infection from somewhere. And what you'll find is then that is passed on to another child, that's passed on to another child, and then that child comes home and passed on to other siblings. And before you know, the whole family is knocked out. How are schools actually doing things to actually protect children's health and obviously from avoiding these kind of situations where because obviously in a school environment you've got hundreds of children all there. If one of those children gets a flu or something like that, you're in a situation where everybody's affected going on to their families.
Yes, absolutely. So that's just gone around in our family already. But I think, so there's two things here. One is, so there can be infections which are perceived to be flu-like, but actually could be a chest infection. They need antibiotics. In those situations, we wouldn't want the child to go to school because they're under medication. But if it's a viral infection and they've got a cold, a congestion, they're feeling a little bit tired, but they're able to keep functioning, to be honest with you, there isn't a problem for other children to get it and for us to get it, because there is part of us that we actually do need to build up our immunity. Now, if we're not faced with viruses which are non-harmful, then our body doesn't build up its immunity. So it is actually quite common for children to get several colds over the winter, one after the other, and it's okay because they are building up their immunity. Of course, it's quite distressing for the parent, and there are other things that we can do to help the child with the breathing and so forth. But actually, if the school does obviously good hand hygiene, cleanliness, obviously when they're sneezing, using the tissue, making sure that they don't, unnecessarily pass it on by sneezing on one another and so forth. I think, to be honest with you, it's not something we would be too concerned about. Because
would you generally advise a child who's not well to, from a working environment, for example, often at works, they do advise you if you're not feeling well, then please do stay at home because they don't want you to pass your condition on to other people. In regards to school, would you suggest that same with children if they're not feeling well to actually stay at home? So
absolutely. So it means. So when I said if they're feeling unwell but they're able to do everything, so if they're running around and playing but they've got a cold, it's different because I think that they can go to school because they're able to do their daily things. Obviously, if they're
be careful with what you say. You're giving children a license out there not to go to school.
So we're being very careful with the wording. Otherwise, today morning we're going to get a lot of children saying that I'm feeling very, very tired and have a high fever.
Let's use big words and confuse them all.
Exactly. But I think if they're lethargic, let's use the word lethargic. But it's very dependent on each child, and I'm not going to say that if they're aching all over, very congested, they have a fever, it's different. And I think as a parent, we should be sensible about how we guide our child to go to school, not to. But if they're well, in the sense that they have a cough and cold, but they're able to do their daily activities, I think we should let them continue to do that because they're on the road to recovery.
Definitely.
And actually their immunity is pretty good.
Definitely, and I think it's very important. I think I just want to reiterate the importance of something you just mentioned earlier on about general cleanliness. And of course, when, say, for example, when you're sneezing, using a tissue, making sure you clean your hands after. I think the general practice, if parents actually instill that in children, and then the schools actually re-emphasize that, I think that in itself will actually, get rid of a lot of problems. And I think general cleanliness, and even from an Islamic point of view, Islam does tell us to be clean at all times. And I think that's something that as parents we can instill that in our children, get schools to kind of reiterate it, and I think that inshallah should help as well.
Absolutely, yeah.
Definitely, we will be speaking about this, of course, in length at 6 p.m. Of course today, 6 p.m. today we will have a live show with yourself, and also we will also have Dr. Beryl with yourself, Dr. Beryl, who is a secondary care doctor, and an expert, a child expert, who will be with yourself at 6 p.m. today. We will speak to you later on, Dr. Anita. Thank you so much for your time this morning, and I hope you haven't put any children off going to school this morning.
Thank you
Thank
very
you so much. Take care.
Thanks, Tim.
Dr. Anita Ray-Chowadhury there, speaking about child health, my dear brothers and sisters. A lot of times it is of course common sense, and sometimes if you're in a situation where, to be honest, I find it strange with a lot of people. Sometimes children, when I was a child, for example, it would be a situation where when I was ill, I did not want to go to school, and I'm sure that's probably with a lot of parents probably saying that, yep, we agree, our children don't want to go to school when they're not feeling well. But my nieces and nephews, for example, are completely the opposite. My sister-in-law, for example, has to kind of keep them home, thinking like, no, you shouldn't go because you're not feeling well. We'll get a phone call to say come pick you up afterwards anyway. But some children actually really enjoy school, and they'll be like, they'll kind of pretend to be better than they are to actually want to go to school, which again I think is a testament to the school, alhamdulillah, where they're actually wanting to go even though they're not feeling well. They must enjoy it so much, which I think is a positive there. But I think it is a situation where if you feel your child is in a position where they should not be going to school, in an attempt to obviously make sure that they get the rest that they need, and B, obviously to make sure they do not actually spread the germs, you could say, obviously to other children. So I think it's very important to make sure that is the case. But of course, in any case, call 111 if you're in a position where you need advice. Sister Said Rauf's mom just texting and saying, I have used 111 in numerous occasions. They are very useful and very helpful. So, alhamdulillah, we've got a testimony there from Said Rauf's mom regarding 111. And I definitely think you should use that service there if at all you are confused in